Good afternoon, everyone. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Pleased to be with you today for our virtual town hall on Thursday, February 4th. We'll cover a number of topics related to the ongoing pandemic response and other matters that are impacting us across HHS. Today, our President and CEO, Rob McIsaac, is chairing a regional planning meeting for the province of Ontario for the pandemic response and was unable to be with us for this broadcast, but we thought it was really important to keep the routine time that we've held for these. And as well, we have a fabulous stand-in today, our Executive Vice President of Corporate Affairs and Chief Financial Officer, Dave McKeag, will kick us off with some remarks and come back later to help with the celebrations as well. Just a reminder to everyone that we have some presentations and we'll have questions. I'll moderate the Q&A. Hold your questions to the best of your ability until the end, and we'll go from there. So Dave, over to you to kick us off.
Thanks, Aaron. Good morning, everyone. And as Aaron said, Rod couldn't be here today, and I'm happy to sort of step in. I'd like to start just by thanking all of you for taking some time and joining us today. But just more importantly, I just can't overstate how impressive your collective and ongoing professionalism, compassion is in the midst of the pandemic for our patients, but also for each other. The teamwork that I see and everyone pulling together is a continual inspiration. So I just want to say thanks for that. We'll hear about several important topics this morning. First, we'll hear from Sharon, who's going to talk to us about pandemic response planning, and that'll include a little bit of an update on the current situation, which is now including transfers from the GTA as work continues to load balance the overall hospital system. So that's a bit of an important shift and role that HHS and others within our region are playing. So we'll hear more about that from Sharon. Dominic will then offer his regular insightful comments on our current pandemic trends, both provincially and a little bit closer to home about Hamilton. So certainly some positive trends that we're seeing and delighted to see continue. Les will then provide an update on vaccines, and certainly a hot topic for all of us. I just wanted to underscore a couple of points if I could take a moment. First of all, our goal has always been, since the first shipment arrived in Hamilton, to get vaccines in everyone's arms as quickly as possible here at Hamilton Health Sciences and our partner St. Joe's. It's still our priority, and we do that in concert with provincial direction on what the most highest priorities are. I will make a comment here that we are encouraged by the line of sight that we have to vaccine supplies and our ability, therefore, to be able to deliver the second doses. So that's some very encouraging news that we're seeing. And I guess I would also say a reminder, if you haven't already done so, done so meaning register for your vaccine, would really encourage you to do that. The details are available on the HHS website. I would also encourage you to really carefully review the specifics of sequencing and select the appropriate category for yourself. If you're at all unsure, just ask, seek out some guidance. And Les will get into that a little bit, I'm sure, in her section today. I'd also like to take a moment to acknowledge that February is Black History Month. And while we spend the month of February each year acknowledging the contributions of Black Canadians and their communities, you know, the tragic events that we've seen over the past year really have brought a new level of awareness and commitment to addressing systemic anti-Black racism in our hospitals and in our communities. And we play an important role, given our size and who we are and the care that we deliver. HHS has begun to take some important steps necessary to addressing anti-Black racism and bring about real change. You'll be hearing a bit more about this work from Bruce Squires and Dr. Sharma throughout the town halls this month and this morning as well. As usual, we'll have some time for these and other topics and an open Q&A and celebrations at the end. And again, thanks to everyone for your patience and continued support of each other. It's again, a truly phenomenal thing to see. Okay, I guess with that, Sharon, why don't I turn it directly over to you for updates on our pandemic response planning.
Great, thank you, Dave, and good morning, everyone. We did want to mention we do have a bit of a technical issue, at least some of us do today on the panel, so apologize in advance if we have challenges, and as well, some of you may be experiencing those with connectivity as well. So in terms of our pandemic response planning, you know, as Dave indicated, our numbers provincially and in Hamilton, they're certainly moving in the right direction. So very pleased to see that. We know that hospitals lag somewhat behind those trends that we see, but we have seen our numbers go down in hospital. We peaked at approximately 100 COVID patients and today sit at approximately 68 patients. You know, somewhat lower than what we've seen in the past few weeks. That said, we still have substantive occupancy pressures across our sites, particularly at our acute sites. That's in part driven by the volume of COVID, but also related to our ALC pressures. We have about 200 ALC patients right now, and that is in part related to the changes introduced in long-term care to eliminate the 3 and 4 bed rooms, and also allowed homes to create more space for physical distancing. So suffice to say, there are additional pressures in the community along with the health human resources that are challenged in that sector, and there is significant amount of planning happening locally, but also provincially, looking at how are we going to mitigate the loss of capacity in that sector, particularly as hospitals, you know, plan for ramp up when we get through this COVID situation that we're in. We do, you know, in terms of our occupancy, we continue to participate as Dave had mentioned in the census load balancing that's occurring across the province and regionally. And this is in efforts to ensure that not one part of our system is unduly burdened by the volume of COVID patients. So there has been a focus primarily on ICU transfers. That's shifting a bit to include ward transfers and to also include not only COVID, but COVID recovering patients. So we will see more of this occurring over the course of the upcoming weeks. And we did include on the slide some numbers there so you can see the volumes that have come in. I should mention for those from the general who think the volumes look low, it doesn't include our regional transfers that we get in through other processes. If we could go to the next slide. Certainly the challenges we face with outbreaks is not atypical hospitals right now. A lot of our peers are facing the same challenges. We have, I believe it's 7 outbreaks occurring across our sites today. And again, a lot of creativity going into managing those outbreaks, trying to create capacity in different ways. I know at the Juravinski site, we've looked back into some old physical spaces in order to accommodate our fractured hip population. So everyone's participation to try to manage these outbreaks, which I know are substantive in terms of workload and stress on the system. So thanks to everyone for that. We also continue as a hospital to support our long-term care home and retirement home sector. We talk a lot about the homes we're supporting, but there's concurrent work happening with those that are not yet experiencing a crisis as we try to mitigate risks of them going into a crisis situation. The good news is there's a positive trend being seen in terms of the outbreak numbers right now in the retirement homes. At one time, we had almost 30 homes in outbreak in our community, and we're down to almost half of that right now. And those outbreaks are much shorter in duration, which public health is also very pleased to see. So some positive direction also in that sector. And then lastly, as we've talked about, we do have a management arrangement with the Grace Villa. We were out of outbreak. Unfortunately, a second outbreak was declared this week. Although it is a small outbreak, of course, the testing and the processes are in place. And the good news is almost all of the staff have returned back to HHS, but we continue our ongoing support of the operations of the home and the ongoing monitoring, and will not be leaving that home prematurely. So happy to answer questions later on, and I'll pass it back to Aaron.
Thanks very much, Sharon, and thanks to Dave as well. Next up, I'd like to invite Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control, to give us a bit of an overview as to where we sit in epidemiology and a few other matters. So Dominic, over to you.
Yeah, thank you, Aaron. You see your usual map of Canada here with the cases per 100,000 per week, and in the arrows, the RT value. You see one red arrow. Unfortunately, Nunavut has another jump in number of cases, so hopefully they get it under control as quickly as they did the last time. I'm on my phone, so it's a little bit challenging today. You see all the other arrows are green. So all of the provinces currently have an RT of less than 1, so continue to trend down. The Canadian average is at 77 per 100,000 per week. Ontario is just above that at 83. Saskatchewan continues to be the province with the highest rates with, again, I have a message here, jumping up 135 at this point of time. Next slide, please. That's our provincial epidemiology, the epi curve. Please disregard the last bar there. A, it's a moving target. B, we had, because of changes in the public health IT system, underreporting happening over the last couple of days. So take that with a grain of salt, but we are somewhere in the range of probably 70 per 100,000 per week over the last few days. So that's pretty much where we had been as a province back in November. So certainly beyond, or certainly much lower than at the post-holiday peak that we saw beginning of January. Next slide. Hospital admissions from a provincial level, we are back to where we had been at the peak of wave 1. So again, we already see here a number of hospital admissions with COVID, a significant decrease, as previously mentioned. It's typically a metric that's delayed, not significantly delayed when you're looking at the provincial picture here. Also in terms of ICUs, the ICU peak was 1 week later and now seem to very slowly, but to be dropping as well over the last couple of weeks. Next slide. Then the Hamilton view again, with a question mark because of reporting issues. I think we only had reported 4 cases yesterday, but knew that this was again a glitch with the new system. And when the reports go out, today we are at 78, I believe. So probably around 40, 50 cases per week right now, compared to close to 200 during the peak. So I would say we are more back to where we had been back in October rather than just back in November at this point of time. And also all the other metrics that public health is collecting are looking much, much better in terms of how quickly they can contact positive cases, how quickly they can contact the contacts of them to get them into self-isolation, which are all very good news at this point of time. Next slide. This is another way to look at it, just looking at the community cases per 100,000 per week, reminding people that we, back before the second wave said, we define non-low epi as more than 20 per 100,000 per week of community cases or unlinked cases, which represents best the risk of the average person walking to our system. Now, again, we are probably not yet below 20, but hovering around that mark. We are not going to change the policies within the next week or two. But just to remind people, again, we are in a much better situation than we had been over the last couple months. It may not feel that way yet. It certainly doesn't at our end, given all the outbreaks we are still struggling with. But we expect that to improve significantly over the coming 2 weeks, because the pressure from the community of cases coming in, being staff or patient, is decreasing significantly. Next slide. In contrast to the provincial view, you can see in terms of hospital admissions of COVID patients, we are still, I would say, at the high level. We may have peaked, but it's not that we see a significant decrease yet. This is partly due to outbreaks. The few load balancing cases do not make a significant difference, but nevertheless, it's maybe another 10, 15 cases here in the mix. In terms of ICU, we see a very small reduction compared to the previous week. So we may have peaked in terms of ICU admissions at this point of time. Next slide. The science table shared new modeling data last week. I think it was exactly Thursday last week. This time, the plausible scenarios that they laid out were all in the minus. So you remember in the previous report, it was between 0% to up to, I believe, 70%. Now the plausible scenario somewhere between -1 to -5%. And then they added in VOX, so the variants of concern, how they may impact what's going on here, but with no margin of uncertainty. So let's wait and see what's happening, and we will get a much more fulsome picture about how much variants of concern we truly have in the province, with now for a certain time period all the positives getting sequenced. And next slide. I would need to move this bar up. I think we are more close to the -5% scenario at this point of time. Today's cases were 1,500. They were around 1,000 the last couple of days, probably an underrepresentation. So we are somewhere between that black line and the -5%. So certainly trending into the right direction. And then last but not least, on the last slide, how will school play into all of this? So here they assumed that by December we had 1% variants of concern, so the UK variant, which seems reasonable given that we are currently probably in the range of 2 to 3% based on the data we have, and how opening schools may affect our future trajectory in like at the tail end of wave 2, I would say. And you can see that school opening, it's not adding nothing. And I think we need to be very clear and open about that. So that's the blue line compared to if schools were to remain closed, which is the orange line. But you can see that the difference isn't huge. And as such, I believe that it was certainly the right decision to reopening schools starting next Monday for our region. Thank you.
Thanks very much, Dominic. Next, we have our Vice President of Clinical Support Services and Surgery, Leslie Gauthier, who's going to give us an update on the vaccine effort. Cameraless update, because I think, Leslie, you're suffering some of the same internet issues that Sharon alluded to earlier. So over to you. Tell us where we're at this week with our vaccine effort.
So good morning, everyone, and I apologize for my internet issues. I don't think I'm alone. So this is a better news story that we're sharing this morning, and it's with a footnote, and really important that people understand the footnote. We believe we're seeing really encouraging news from the province and from the manufacturers of the vaccines around our supply chain starting to become more stable. So we have a plan in place. The caveat, which is the footnote at the bottom, is the plan is dependent that the vaccines actually have to arrive. But we are pretty optimistic about what the next few weeks will bring. So at this time, we've started, and people, I'll speak to it on the next slide, should have received second dose appointments if you were originally scheduled for your second dose from the week of the 27th of January to the 31st. So anyone who was originally scheduled January 27th to the 31st should be receiving appointments the week of February 10th and the 14th. And then our hope is we're going to continue to follow for all of those other people in sequence for second dosing. The principle by which second doses are being scheduled is in alignment with provincial direction. And that direction is we are to schedule between day 35 and day 42. And we've received very clear direction. We're not supposed to be starting any first doses at this time. We do have a plan in place if there's any residual doses. We're not wasting any, but there's no immediate plan right now that we're starting first doses until we get direction from the province. If I can go to the next slide, please. This is very specific to people who are being notified about their new appointments and dates. So based on the emails that people submitted when you registered, you'll get an email and text telling you your new appointment dates and times. We are really appealing to people to accommodate that new appointment. If you can appreciate, there's like over 5,000 people in totality being rescheduled. So we really do people's need support to do everything possible to keep to the date that gets assigned by the clinic. The second bullet is new as of this morning, and this is from Brian Hirchak. So if you, anyone who had an appointment between the 27th and the 31st for second dose, and you did not get an email notification of a revised date, there is a new email address, or sorry, this is back at Cancel Vac. Actually, and I need to check on that because I think we did land a new email. So we'll send out a communication about this one. But you can start now by emailing Cancel Vac or call in at the number that's provided there. And we'll make sure that we don't lose you. And then the last is, again, we're getting a number of requests of people who are moving. So most typically residents who started in Hamilton are doing a placement in Toronto or Ottawa. And the direction we're being given is to advise people to return to Hamilton to your second dose. So there really isn't a mechanism in place if you got a first dose here to get a second dose in London or a second dose in Ottawa. And that's a consistent principle across the province at this point in time. The last slide to share with people is just some general updates and a big sincere thank you. We started this in our last conversations. We know how disappointed it has been to people, both in their personal and their professional lives when the vaccine work got put on hold. We're extremely appreciative that people are being respectful and working with our scheduling staff. And we're all trying to work together. And the goal is everyone who wants a vaccine will get a vaccine. So thank you for your understanding for the situation we're in. The second bullet is the second hat I often wear, and that is as a co-chair of the PPE task force with Dr. Sarah Kahn. Vaccines are not going to take the place of good PPE practices. And we need to remind ourselves and we need to remind our colleagues to be diligent in terms of wearing masks, maintaining physical distancing, good hand hygiene. Really important things is to be very mindful that you're masked whenever you can be on your breaks, that you think about things in carpooling and you continue your PPE practices in the car to and from work. So we just want to make sure that we keep that organizational awareness up to the importance of PPE. And the last bullet is that there is an FAQ that is constantly being updated with questions that are coming either through the Cancel Vac line or to a number of individuals. We are working with our infectious disease specialists and vaccine specialists to update that information. So it will be a live document for people as you need any information. So with that, fingers crossed, supply of vaccines looking good. Our goal is to get everybody vaccinated who wants to be vaccinated, and really appreciate everybody's support in helping us get there. So I'm going to turn it back over to Aaron. Thank you.
Thanks very much, Leslie. So next up, I'd like to invite Bruce Squires, our Vice President of Children's and Women's Health. Bruce is going to walk us through a little bit of what's going on in the organization around equity, diversity, and inclusion, and specifically in relation to Black History Month. So Bruce, over to you.
Thanks very much, Aaron. And yeah, I am going to focus on Black History Month today. Next week, Dr. Sanjay Sharma will join me, and we'll talk much more explicitly and in detail about the work of the President's Advisory Council on Equity, Diversity, and Inclusion. So really encourage folks to join us next week. As Dave mentioned at the beginning, February is Black History Month, and that really arises originally from an American designation, and February was selected because it happens to be the birth month of Abraham Lincoln and Frederick Douglass, two individuals who played a very key role in the elimination of formal slavery in the United States. But we know, of course, that very significant and important event unfortunately didn't eliminate the presence of anti-Black racism and oppression of of our Black populations, not only in the United States, but also in Canada. And so the month of February is an opportunity for sure to celebrate the contributions of Black Canadians across the country and throughout our history. But as well, it's a chance to acknowledge and to educate ourselves. Many of us, like myself, those in positions of power and privilege, who don't face the oppression that our Black and Indigenous citizens do face. And so want to encourage folks to take advantage of the opportunity to created by the month to learn more. Certainly our Human Rights and Inclusion group has a number of resources available through the hub, including access to our equity and diversity grounds and that have a number of great sessions, including ones on exploring bias in medical care. There also are a listing of a number of the events taking place in the community, our wider community and across Canada. Obviously, the year of the pandemic makes this look different in terms of how we can acknowledge and recognize. But I think, as Dave has highlighted, the events of the past year have also, I think, helped more of us to recognize that systemic racism and anti-Black and anti-Indigenous activities continue to exist. And so this is a month to reflect on that and to each make our own commitment to being anti-racist. Again, look forward to talking to you more about the activities of our advisory council at next week's meeting. So with that, back over to you, Aaron.
Thanks very much, Bruce. We'll look forward to that presentation next week. We do have a chance now for some questions in our agenda. Just a reminder to everybody that you can always peruse the resources available on the HHS website, the COVID-19 section of the HHS website, as well as information that's available elsewhere on the hub and on the website. But this is a great opportunity to ask specific questions about things that are topical. I know some have come in through the Q&A box already, and we'll wait. If anybody would like, you can do two things. You can type a question there in the Q&A section. Please use the Q&A section rather than the chat forum. We use the chat forum for celebrations, Q&A for questions. And you could also raise your hand in the participants box, and we'll call on you to ask your question live. So maybe I know it takes a few minutes for people to type something in. Maybe I could go first to Dr. Mertz. One of the things that we've been seeing a lot about in media, at least this week, is around the issue of double masking. And I think in particular, as the increase of new variants of COVID-19, I guess the presumption being that an additional layer of protection can't be a bad measure. Can you give us some insight on how important double masking is in the spectrum of tools that we have to protect ourselves from COVID-19?
Yeah, unfortunately, double masking is currently in particular the media, it's really driven by media, considered the new silver bullet that will bring us out of the pandemic or better control the variants of concerns. None of this is really true or evidence-based. I think all of this has been triggered by Dr. Fauci's interview last week, where he said, yeah, he doesn't see anything to be wrong with double masking. What he probably had in mind is that if you're out and about in the community and you're wearing a cloth mask, which may be just a single layer fabric, then you may actually be better off with 2 layers. But people started to sort of generalize that to any mask and then the N95 surgical mask combo, and that by no means was the intention. CDC's recommendation actually is still a 2-layer mask. So they haven't changed any of their recommendation, not because of variants of concerns or for any other reasons. The PHAC, so Public Health Agency of Canada, recommend 3-layer masks since last summer. And I remember then people were like, well, are our medical masks okay? Yes, they are. They are all 3-layer, and they are superior than any random 3-layer mask that you will find out there, which is based on fabric. So again, don't generalize from such a statement to what you're doing in the healthcare system. And then a compounding factor is the N95 surgical mask combo, which is really concerning, and we continue to see that more and more. The only effect that you will have by doing so, you have an N95 that's fitted to your face, that is supposed to be snug and don't have any spaces around your mouth. Once you put something on top of that, you put yourself at risk that it's not snug anymore. So if anything, you're going to increase your risk of getting infected rather than decreasing. And as an employer, the way we look at it, we are responsible for the safety of our employees and that they use PPE appropriately. Putting a surgical mask over an N95 is not considered appropriate use of PPE. And we will, or we are working on communication around that. Not sure whether Les would like to weigh in as well.
Leslie, did you want to add, Adele, to Dominic's comments?
Just the only comment I will add is this question has come up to the PPE task force, and we're working specifically with our colleagues in health, safety, and wellness for some broad communication for people to share with teams over why we are not in support of the double masking. The only exception to that are very specific individuals who've been to employee health and need an accommodation because of a sensitivity to a mask. But we'll have much more specific information that'll come out in the next couple of days from the PPE group. Thank you.
Thanks very much. We do have a question here in the Q&A forum, again, on the topic of masking, really about if in a shared office space where you can achieve physical distancing, is it still required to wear a mask? So assuming that they're speaking about some of the open office spaces we have where people might be in the space together, but they can maintain the appropriate physical distance, is it still required to wear a mask? Maybe.
So I'm happy to, I'll start from the PPE task force and then Dominic can chime in. This question has come to the task force a number of times. So important principles people remember is all of us on entering the buildings, or actually before we get to the front doors, are self-screening and completing that self-assessment to say we're safe to come to work. As we walk through our halls, the expectations are that people are in fact masked. If you get to a work environment where you are able to maintain 6 feet of distancing and non-clinical, so non-forward facing areas, the current policies allow that you do not have to be masked. It's an individual's discretion if you want to choose to continue to wear your mask while you do your work. But as long as you're maintaining the 6 feet of distancing, and likewise, you do your own assessments. So if there's something about your coworker that was concerning, absolutely, you have the right at any time to put on your own personal mask. We do ask you to be mindful if you get out of your workstation and you went to a common kitchen area or sink, that you would ensure that you have your mask when you're leaving that 6 foot radius. So Dominic, I don't know if you'd like to add to my comments.
No, I couldn't have said it any better. Thanks, Leslie. I don't think I have anything to add.
Okay, thanks very much for that. Another question from Dale Bialis in our Q&A about staff asking about universal eyewear. Is that currently a recommendation? So eye protection, is that something that's currently recommended or required in our spaces? Dominic or Leslie, I'm sure you'll have an answer for that.
Yeah, I don't know how many hours we've spent on this topic already. It's one of those evergreens that keep coming back. It's on the consideration. We are looking into more data currently as well within what we are able to pull. Again, it's most certainly not the silver bullet. Otherwise, we would be in universal eye protection. It may add some risks in some circumstances, in particular if you're not handling your eye protection right. And we see a lot of face shields just laying around on charts, etc., most likely not being cleaned. So it's not a clear risk benefit, or not a clear benefit in having universal eye protection. However, we are struggling with the current policy, and I would like to remind you of that. Our current policy is you put on eye protection when you have contact with a patient who's not able to mask or not willing to mask. If you were to follow this policy, there wouldn't be any exposure if that patient is considered to be positive later on without you knowing at that point of time. But what we see is numerous breaches where people don't put on eye protection and patient is not masked. So I think that that's the challenge we have currently. And the question at this point is it an operational and educational issue that people cannot adhere to the current policy? And is the solution to that we just say universal eye protection? There's many hospitals, as you know, that have universal eye protections out there. They are struggling with outbreaks as much as we do. We see outbreaks on units where we have universal eye protection. If it was the silver bullet, we would have it implemented. We don't feel that's the case. That's why we haven't gone down that route yet. If you feel more comfortable with your eye protection on, by no means, nobody will take that away from you. But we don't have a policy at this point that you have to have eye protection on at all times.
So if I could maybe just add to that, there will be some clarification on how to order eye protection that will be coming out from the PPE task force. We talked about making sure managers have the right information to order supplies for when it is needed. The second is just to remind all leaders on the call that if there is a request to change a standard of PPE on your units, that request we're asking comes through the PPE task force, so that teams aren't independently making a blanket statement everybody on this unit will wear. And that is superseded by the principle any one of us does our own personal PCRA at any time. And if you feel you need the protection of eye protection, that's in your toolkit to pick up and use. It's just to reemphasize Dominic's point, we've heard lots of feedback about people using eye protection, taking it off and just leaving it at a desk in other areas, which is personal risk you really have to think about when you're donning it, is how and where you doff it.
So he's got multiple stones in his bile duct.
Thank you very much. I think we hear someone in the background, just clarifying that everybody go on mute, not currently speaking.
Yeah, I don't think he should go home.
Dr. Lum, you're not on mute.
There we go. I actually have the power to mute you, so I've done that for Dr. Lum. Just looking at our Q&A here, Leslie, maybe this will be our last question. I recognize there's some other ones. We'll try to get to those by email so we can move on to our celebrations, or we'll post an answer in the FAQ. For those that are scheduled for a second dose after February 1, is that, I can't recall from your earlier presentation, I think the timeline was for people, we're calling those that were scheduled earlier than that. For those that were scheduled after that, will they receive an email or a call?
Right, so same process will happen. We're just doing the week of the 27th this week, and then we'll move on to the subsequents. I don't know if Bruce had further comment to that. No.
That's right.
Yeah.
Okay, so we'll see, maybe we'll have an update as that moves forward. So thanks for that. I'm going to suggest we move. I know there are some other questions still. We'll do our best to get to those either by adding to an FAQ or following up with people individually. You can always send questions to hhsnews@hhsc.ca. We use those to inform the content of these webinars, and we also are able to provide answers back to people directly. So please take advantage of that. Maybe Dave, if I could ask you to join me, we'll do celebrations. So a reminder to everyone that's participating today, you can type a celebration or a shout out you'd like to make in the chat box. Dave and I will read that out loud. You can also raise your hand as a panelist or an attendee, and we'll call on you to give a live shout out or a live celebration. I know there's one that's in there that's, why don't I start, Dave? There's one, I pulled it up by email. It's quite lengthy. Someone posted in a wonderful letter.
Wonderful, yeah.
spectator. I'll read the letter in full. I spent several long stretches last week assisting someone in Hamilton General Hospital Emergency Department. What I saw and heard there was a revelation. We have the right to expect a degree of professionalism from the nurses there, but what I witnessed was a level of caring and kindness that far exceeded those expectations. One long evening, we were there. There were several elderly people who had taken falls or had some other urgent situation. Some had continence issues. Others had to be checked for signs of dementia. Some couldn't communicate well. There were other patients who were intoxicated or moaning in pain. The nurses and other staff dealt with them all with such patience and consideration that it has been a lesson in humanity to all of us. Not once did I hear a sign of impatience or stress as they are all under. We owe gratitude and recognition to these women and men who, in the midst of their worst healthcare crisis in a generation and working under the stresses and COVID protocols, ensure that their patients are treated with dignity, affection, competence, and professionalism. So wonderful letter in the spec.
I see, actually, Les, I don't know, maybe because you're not on camera, I'll read out your comment. Congratulations to the DI ultrasound team who worked with the Innovation Committee and specifically Brian Herchuk on the creation of extended face shields. Great media attention to this awesome work. Congratulations.
Thank you.
Erin, it's Kelly.
Hi, Kelly.
Yeah, I just want to celebrate, in the midst of the pandemic, lots of other great work has been going on in capital planning for the new West Lincoln Hospital. And as staff may have seen, we received some really important approvals from the ministry over the last few days. The first was a planning grant for $15 million to continue our planning work. And then the official stage 2 approval from our submission in late October, so that we can formally move on to stage 3 planning, even though we're already well into it. So those are really important approvals for us to continue to move forward with the very aggressive timelines that we have for that project.
Awesome, great point, nice. See here one from Katie Ferguson. Dave, you want to go ahead? I think I've done all the, I deserve a break from reading after that first one.
You did so well. Sure. Katie Ferguson has said, thank you so much to the EAs who keep our hospital clean and safe. I am so grateful for their hard work and recognize this is not an easy job. I don't think it's ever an easy job, and the extra diligence that that team puts in place right now to try to keep everyone safe is, you can't overstate how important it is. So completely agree, Katie, and thanks to the team.
Good stuff. I see Leslie with her hand up. Go ahead, Leslie Gauthier.
Yeah, so I actually want to just give a lead in for Bruce. And I really think I'm seeing a question in the chat line about the status of vaccinations of the long-term care homes in Hamilton, and thought I'd just toss it over to Bruce to share some really good news about Hamilton long-term care.
Oh, do tell, Bruce.
Yeah, I think Bruce had to sign off,
Oh,
actually,
okay.
so share away.
Sorry, I'm playing catch ball and no one's catching my ball. So across the province, there has been data circulated this week on the status of vaccinations in long-term care. And thanks to really awesome teamwork with public health, and Bruce and Michelle Baird from public health co-lead this work, the Hamilton long-term care, we have the highest vaccination rate in the province. As of a point in time this week. So I don't know if the data has changed in the last 2 days, but lots of acknowledgement that the teams did really good jobs getting out there and getting the long-term care residents who wanted to be vaccinated.
Good stuff. Thanks for sharing that. See,
there's one here from Sandra Andrzejczyk. A shout out to the Best Practice Restraints Committee and leadership for creating an addendum for the wandering patient during COVID-19, taking into consideration the principle of respect, autonomy, and dignity to every patient, family, and staff and physicians that this would impact. So yes, important reminder on how difficult it can be to care for our patients under the best of circumstances, and doing it within COVID-19 is an incredible accomplishment.
good stuff. I see one here from Chris Crowley. Big kudos to the Hospital to Home program. What a special program that is. I'm proud that HHS has it and supports it. It's an important thing for improving community health. Thanks, Chris, for adding that. Well, Dave, I'm going to suggest we call it there. Maybe final word to you.
Thanks. And just thanks again to everybody for taking some time to both share your thoughts, your questions, your celebrations. And it's an important thing that we do every week to try to maintain all of these lines of communication. So much appreciate your attendance and all the work you do every day. So with that, why don't we sign off? And I hope you have an excellent rest of Thursday. Take care, everyone.